Welcome back to your Pediatric Dentist channel Tiny Tit Talks. If you are new to this channel, subscribe the channel, and for details of this channel, visit the bio section, or you can also check out my previous videos. Today we will cover fear and anxiety, which is one of the most important topics in pediatric dentistry for both UGs and PGs. Even in your dental practice, it is very important. So let's start. We already know that when child is on dental chair, there is always fear and anxiety. So let's understand these so it will be helpful when the patient is on chair by your side. So the first investigation into normal fear having been published by Hall in 1897. Here are some definitions to understand terminologies more precisely. So the first definition is fear. According to Dorland Medical Dictionary, fear is the unpleasant emotional state consisting of psychological and psychophysiological, basically mental and physical, responses to a real external threat or a danger, including agitation, alertness, tension, and mobilization of the alarmed reaction. According to Rubin, fear is defined as a reaction to a known danger. Coming to the emotion, emotion is defined as an expression of readiness to establish, maintain, or change one's relation to the environment on a matter of personal importance. Emotion helps us respond to things that matter to us by preparing us to act or react in some way. Dental anxiety. Dental anxiety denotes a state of apprehension that something dreadful is going to happen in relation to dental treatment, and it is coupled with a sense of losing control. Basically, the nervousness of fear about dental care. Coming to the dental phobia. It represents a severe type of dental anxiety and is characterized by marked and persistent anxiety in relation either to clearly discernible situation or objects or to the dental situation in general. So discernible situations or object are the situation or object that related to sense like noise, smell, seeing needle, etc. Coming to the fear related emotional patterns. So understanding these emotional responses helps dental professional tailor their approach to each child's psychological need. So the first is shyness. So fear of unfamiliar people, not objects or situation. Common around 6 months of age, which is called the strange age. Babies recognize stranger but don't understand they are not dangerous. Intense shyness can lead to long-term social timidity. Typical behavior, so in babies, they are mostly crying, turning away, clinging to caregivers. Toddlers running away, hiding, and old children blushing, shuddering, avoiding speech, nervous gestures, etc. Now, in that situation, what dental professionals should do? So, use a calm, gentle tone and slow movements. Allow time for the child to observe before engaging. Involve the caregiver in the interaction. Avoid overwhelming the child with the questions or attention. The second is embarrassment. Fear of being judged by others. It is not triggered by strangers but by social evaluation. Develops after the age of 5 to 6 years. Linked to self-consciousness and past experiences of social failure. Can lead to exaggerated fear of future judgment. In this situation, what dental professional should do? Avoid drawing attention to mistakes or awkward behavior. Use positive reinforcement and praise efforts. Normalize feelings by sharing relatable stories or example. Maintain privacy. Worry. Worry described as imaginary fear or borrowing trouble, not caused by real events but imagined dangers. Common worries are related to home and family issues, peer relationship, and school problems. Children who feel insecure may internalize or exaggerate worries. Extroverts tend to talk about worries more than introverts. Children who feel inferior and inadequate tend to internalize their worries, thinking about them and exaggerating them out of all proportion. Children who feel both insecure and rejected often verbalize their worries in the hopes of winning sympathy and through it improving their social acceptance. In this situation, what dental professionals should do? Acknowledge the child's concern without dismissing them. Offer simple, honest explanations about procedures. Use visual aid or storytelling to demystify treatment. Encourage open dialogues and reassures with facts. Anxiety. Anxiety is a general feeling of uneasiness or dread, which comes from anticipated threats, not current ones. Often feels vague and hard to explain. Can become free floating anxiety, which is fear in any potential threatening situation. It is different from the worry. How? Worry is about specific problem. Anxiety is more general. Worry is based on objective concerns, anxiety is more subjective. In this situation, what a dental professional should do? Use structured behavior guidance techniques like tell show do. Break procedures into small manageable steps. Offer choices to give a sense of control like flavor of fluoride. Use distraction techniques like music and videos. Consider sedation options if anxiety is severe. Now, there are so many effects of emotions on the children which might be a positive or a negative. So, emotions make everyday experiences more enjoyable. Emotions prepare the body to take actions. Emotional tension can disrupt physical coordination and motor skills. Emotions help children communicate without words. Strong emotions can interfere with the thinking and learning. Emotions influence how children are judged socially. Emotions shape a child's overall outlook on life. Emotions affect how children interact with others. Facial expression often show emotional states. Emotions influence the psychological atmosphere around the child. Repeated emotional reactions can become habits. Young children show worry through facial expression. Older children may hide their worry to appear socially acceptable, and some children may exaggerated worry to gain attention or sympathy. Now, there are types of fear. One is general fear and one is dental fear. In general fear, there is the active or real fear and imagined fear. First is general fear, in which first is objective fear or real fear. So, fear caused by direct sensory experiences, things a child sees, hears, feels, smells, or tastes that are unpleasant. For example, pain during a previous dental visit, the smell of dental chemicals which linked to past discomfort, and seeing white uniforms that resemble hospital staff who caused pain. Clinical impact. These fears are deeply rooted and harder to overcome. Pain perception is heightened when fear is present. This is called a lower pain threshold. Means a pain threshold is the point at which a stimulus become painful. When someone has a lower pain threshold, they feel pain more easily and more intentionally than usual, even from mild stimuli. Children who have experienced pain during dental treatment are more likely to develop dental anxiety. This is especially true if the pain was not acknowledged or managed properly. The second is subjective fear, imagined fear, fear based on stories or attitudes passed down from others without the child having experienced the situation themselves. For example, hearing parents or friends talk about painful dental visits. Shoben and Bolland reported that fear of dentistry in adults was based more on what they heard about dentistry from their parents than on anything else. Observing fear in others, especially parents, being told it won't hurt before even knowing what's coming. Basically, what is mechanism is children have vivid imaginations and can magnify stories into terrifying mental images. Fear can be learned through imitations. This is called vicarious learning. Scientific insight is parental anxiety strongly influences children's dental fear. Study shows that maternal dental anxiety correlates with higher anxiety in children aged 7 to 8 years. Now coming to the dental fear. So there are five factors which are important to understand the dental fear. So first is the fear of pain or its anticipation, which is expecting pain. Children may fear pain even if none occurs. Misinterpreted sensations like cold water can can be perceived as a pain if the child expects it. Explaining nerve signals in child friendly terms helps reduce this fear. Kakkar et al. Found that 63.8% of the children aged 3 to 14 years had high dental fear, often linked to pain anticipation. So, what happened? Children worry that something will hurt even if it doesn't. So, they may have felt pain before at the dentist. They might have heard scary stories from others. Their brain is on high alert, so even a gentle touch can feel painful. So, for example, a child might flinch when the dentist spray cold water, not because it hurts but because they expect it to hurt. So how to help? Use simple explanations like this medicine makes the ouch wires in your tooth go to sleep, but you'll still feel me touching it. Always listen when a child says something hurts, never ignore it. The second is fear of betrayal, losing trust. If a child's pain is ignored, they might feel betrayal. Trust is essential and can be shaped by parental attitudes before the child even meets the dentist. Ing et al. Emphasized that trust and communications are critical in preventing dental fear. So, what happened? Children feel scared if they think the dentist won't listen or will trick them. If a child says it hurts and then dentist keep going, they feel betrayed. If parent says it won't hurt and it does, trust is broken. For example, a child who was promised just a checkup but ended up getting a painful injection may not trust future visits. So, how to help? Be honest and gentle. Build trust slowly. Let the child know what's happening and stick to your words. The third is fear of lose control. Children feel safer when they have choices. Giving small decisions like which tooth to polish first help restore a sense of control. Yusel et al. Highlighted that empowering children with the choices reduce the anxiety. So children feel helpless when they can't make choices or stop what's happening. They are used to parents making decisions, but they still want some control. Dental treatment can feel like they are trapped or forced. For example, a 6-year-old might feel calmer if they can choose which tooth gets cleaned first, even if they can't choose whether to get it cleaned. How to help? Offer small choices like do you want the strawberry or bubblegum flavor? Let them ask questions and explain things in kid friendly ways. Then the fourth is fear of unknown. Lack of information or vague reassurance can increase anxiety. The tell show do technique help familiarize children with procedures. Ing et al. Recommended developmentally appropriate explanation to reduce the fear of unknown. So children are scared because they don't know what's going to happen. Because of new places, strange tools or unfamiliar sounds can be overwhelming. Vague reassurance like it won't hurt can make things wrong. A child who hears don't worry might start worrying even more because now they think something might go wrong. How to help? Use the tell show do method. Then the fifth is fear of intrusion. Dental procedures invade personal space and may feel threatening. Criticism about hygiene or diet can feel like a personal attack, especially for older children. Yusel et al. Note that perceived judgment during dental visits can worsen anxiety. So the children feel uncomfortable when someone gets too close or goes inside their mouth. The mouth is a private space and the dental tools can feel invasive. Some children feel judged or criticized during treatment. For example, a child might say, I don't like that thing going inside my tooth, or avoid visits because they feel embarrassed about their brushing habits. So, how to help? Be respectful and gentle with their space. Avoid blaming or shaming. Focus on encouragement and support. When it comes to management of fear and anxiety, it includes all the behavior modification techniques. But before that, as a pediatric dentist or clinician, you should know that the level of dental anxiety of your patients. So for that, there are so many psychometric assessments for dental anxiety. We will discuss that in future and then we will move forward with the behavioral techniques in detail. These are the references. If you want this as a PDF or any other PDF, like, subscribe and comment your mail ID with the topic and I'll share you the PDF. New videos on Sunday, and don't forget to check out our topic of the week on shorts. So press the bell icon for every update, like, share and subscribe. Thank you.